Hi, I'm Dr. Daniel Mazur. I'm one of the partners here at Urology Associates. My specialty is infertility and andrology, so I focus in male sexual health, including erectile dysfunction and Peyronie's disease, and also issues with male fertility as well. Erectile dysfunction is very common. It's more common than people think. Age is the biggest risk factor that we know of in men. The biggest other one we see is diabetes. Things such as vascular disease and cardiovascular disease can contribute as well. Sometimes certain medications can also be an effect. So it's a very common thing that we see. I think it can obviously be an uncomfortable thing for some men to bring up, but thankfully we talk about it all day long. So I think most men in the clinic are very comfortable when we have a conversation with it. So a lot of it's initially kind of exploring what's going on with your issues and some of your medical history, and then kind of exploring options or maybe some workup we need to do and treatment options as well. The therapies are all very much focused on increasing blood flow down to the penis. That's the thing that induces an erection. So most people are familiar with the pills that are out there. It's often considered kind of a first-line therapy. There are penile implants. There's some other things such as vacuum devices. As technology has evolved, there are new therapies as well, one of them including low-intensity shockwave therapy, as we call it. A shockwave is a penetrating energy or sound wave that's going into the tissue in the body. The machine here at Urology Associates is one of the top-of-the-line machines on the market. A lot of clinics around the country actually use different machines that aren't quite as effective. Additionally, here at Urology Associates, you are being treated by people who have spent their entire careers focused on urologic care, including the therapy of erectile dysfunction. I know that the name shockwave may sound a little scary at some point, but it's very safe therapy, and for most people, it feels like tapping as the energy is delivered. So a little bit of soreness and some tapping, but that's really about it that all people complain about. So in general, very low risk and procedure. Treatment can be very individualized. The usual treatment course is 6 sessions, spread out over 3 weeks or 6 weeks, depending on the individual. There are different energies that can be delivered depending on the individual as well. The treatment each session usually takes about 15 to 20 minutes. There's no restrictions afterwards, but some men can be a little bit sore down there. So we generally encourage you to take it easy for the rest of the day. So this is the shockwave machine. This is the probe that delivers the energy. To deliver the energy, we do have to apply some ultrasound gel. And then the probe is applied to the area of treatment. So I'll do it on my arm. And really, that's the noise you would hear during the treatment. So there's a clicking noise, and then you do feel kind of a tapping and a tingling. And there's different energy settings, so depending how guys are feeling and tolerate, we can go up or down on the energy for their comfort level, and also depending on the protocol based on their degree of erectile dysfunction. Like all therapies, it's not a one therapy fits all. The benefits of low intensity shockwave therapy is it's a non-invasive therapy that can be done in the office with minimal discomfort. You can do it for anybody, but generally the milder the erectile dysfunction, the more robust the response.